February marks Black History Month, a time to celebrate the accomplishments despite the obstacles and mark the moments of fortitude for Black Americans from yesterday and today. Here at Sharecare, we know innovation is important. So what better way to celebrate Black excellence in America than honoring the medical advancements that came from the hearts and minds of this community, namely Dr. Kizzmekia Corbett. The 2020 novel coronavirus pandemic continues to reverberate across our healthcare system and personal lives alike. But the unprecedented research, development, and distribution of mRNA vaccines have changed the severity of the disease and the course of life in this new decade for millions of people. That's thanks in large part to Dr. Corbett. She's a viral immunologist by training and is the scientific lead for coronavirus vaccines and immunopathogenesis team at the National Institutes of Health. It was Dr. Corbett and her team who developed the viral sequence data for their industry partner, Moderna, a scientific and medical triumph that just 66 days later was being given in human trials. This groundbreaking achievement in medicine is a significant moment in Black history, as well as an unprecedented moment for the world of health and life sciences. Today, Dr. Corbett is an assistant professor at the Harvard T.H. Chan School of Medicine and continues to work on the coronavirus preparedness. She remains steadfastly devoted to mentorship, vaccine awareness, and STEM education for young people.
Have you been on the other side of where you're saying, hey, I did not know the in and outs of how this system was supposed to work for me, but I can tell you how it failed me?
For me personally, I've had a few experiences where I've been discriminated against. Half of my family's light skin and the other half is darker. And so growing up with my mom who's lighter, I just wasn't prepared. Like I just saw her experiences. And then when I was in the emergency room and I was the one being treated, I'm like, how come it's so different? Why am I having to fight in order to get care versus when I go with, some of my family members that are lighter skin? Why is their experience such a different experience than my own?
Wow. So the issues of colorism, even within the Hispanic community, and we know how that has plagued the African American community.
I have experienced negative disparities and very racist aspects from the system, meaning our healthcare system, because it is a part of the larger system, right? And so my own aspects of this is that, you're going to be suspect to the system being what they're telling you, medical information, you name it, because who knows what the validity or the truth that lies within what we're telling you exists. And so that is a personal thing that every single person had to go and, dissect for themselves.
I actually went through 3 physicians during my pregnancy. And it was because the first 2 physicians, I did endure a lot of the feeling dismissed. And for myself, and this is as an advocate, what I try to help patients with is advocating for myself, but also realizing I have a choice. I can choose better healthcare. I don't think this is how I should be taught.
February marks Black History Month, a time to celebrate the accomplishments despite the obstacles and mark the moments of fortitude for Black Americans from yesterday and today. Here at Sharecare, we know innovation is important. So what better way to celebrate Black life in America than honoring the advancements that came from the hearts and minds of this community, which is why we're spotlighting Mae C. Jemison. A physician, engineer, and astronaut, Jemison made history in 1992 as the first Black woman to travel to space. Her role on board the Space Shuttle Endeavour was just as groundbreaking as a lunar landing. NASA created a position just for her, a science mission specialist which focused on scientific experiments in space. Before her voyage to space, Jemison was the medical officer for the Peace Corps, primarily focusing on the organization's efforts in Liberia and Sierra Leone. Today, Jemison is the founder of the Jemison Group Incorporation, a consulting firm that concentrates the impact of technological advancements in design, as well as the Dorothy Jemison Foundation for Excellence, which organizes science camps, forums, and new entry points for young people interested in science and space.
We've been behind in messaging, and therefore we're behind in care, and therefore we're ahead in HIV infections, even for trans-identified folks. I'm a Black trans woman, and I make sure that I generally will announce myself as Black as if folks couldn't figure it out, because we can't talk about my trans identity without talking about my Blackness. And we can't talk about my Black trans womanhood without talking about HIV and how simply because of who I am and who I have sex with puts me at greater risk for HIV infection. So let's hear a little bit about that. First as a Black person and then as a Black trans person.
Wow, it's amazing that you asked me this question because I have a very interesting experience behind this. So I was sent a script to audition for a PrEP commercial. Now, I was living in Atlanta and it has a unfortunately high HIV population, okay? So you would think that we would be more educated and have more access to these things. Now listen to this. I had never heard of PrEP before. That was my first time, was for an audition for a PrEP commercial. Now I'm living in Atlanta. The commercial, I found out, wasn't even for the Atlanta market. It made me think, who else doesn't know about this in this city that is majority Black? And so I moved to New York and I expressed to my doctors and things like that, I was like, this experience. And they shared with me how important it is for us to make noise to our lawmakers, our lobbyists, everything like that, because that's what's going to change. They are going to continue to overlook us if we don't make enough noise.
It's so important. Thank you for saying that.
February marks Black History Month, a time to celebrate the accomplishments despite the obstacles and mark the moments of fortitude for Black Americans from yesterday and today. Here at Sharecare, we know that health and progress go hand in hand. So what better way to celebrate Black excellence in America than honoring the advancements that came from the hearts and minds of this community, and specifically in historically Black colleges and universities, or HBCUs. In 1881 in Atlanta, Georgia, Spelman College became the first school for Black student nurses. A few years later, in 1886, Howard University School of Medicine in Washington, D.C., a school initially established for educating Black doctors, opened its doors to both Black and white students and both men and women. Of course, the work of HBCUs do still have lasting impacts across the country. Today, these colleges and universities are responsible for 40% of all Black engineering graduates, and in the political arena, 40% of all Black congresspeople. What's more, 80% of all Black judges in America attended an HBCU. There's an achievement around every corner in medicine, politics, and beyond. How will you celebrate this month?